Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, everybody, and welcome to the Medical Collective. Once again, I feel like it has been forever. I have been traveling with work as usual. It's back to school time, and I just feel like I have not been able to record like I wanted to. So I'm excited to be able to speak with you all today. Wherever you are, I hope you're having a great time. Just sit back and listen to this. It's some informative information, and it's one of those conversations we have to have. And it's the elephant in the room, the bad word called cancer. And this hits home to me, you all, when I tell you that this really is something that touches me, not because I diagnose it every day, because as loved ones have it, it really makes me be more aware of what we need to be talking about. And that's cancer. And even more so, it's about cancer in younger people. Why is it surging? What can we do? What can we do to prevent it? And can we at least be able to tell people like one of those warning signs that we should be looking for? So that's where we're at today. And I want you guys to be able to take something from this to a loved one or a friend about cancer. And it is on the rise. I have probably been saying for the last couple of years since the pandemic, I feel like the more I look like at cases, I see more cancer. Yes, I have been seeing that. I keep looking, and I'm like, why do I see so much cancer? And why do I feel like it's happening in younger people? And the real news is that it's us. It really is happening. It really is a rising cancer. The data is showing it. Cancer has always been a disease of the older people, as we say, but it's not like that anymore. Rising ages actually globally are happening under 50. So that mark of when you're below 50, you're immune, nothing can get you or catch you unless it's an accident, those days are gone. Actually, one of the statistics from cancer.gov is that early-onset cancers, particularly in breast, colorectal, pancreas, and gastric, are rising. Also, there's a report that nearly 2 million new cases are projected this year in the United States, and particularly increasing in the younger adults. That's the 30 to 40-year-old population, which before we weren't screening, and we haven't been screening for them. So how do we get the word out, and why is this happening? Here is a study, and this is about colorectal cancer. Right now, it's the second leading cause of cancer death in people under 50. That's what studies are showing, that under 50 years old, we are seeing more people with colon cancer than we should expect. And that's a problem. The ACS lowered screening to age 45 in 2021 for colon cancer. So before it was 50 and now it's 45. And that is for average risk. I'll talk about that later. So average risk people that don't have a family history, that don't have other risk factors, they can get screened at 45. Now, since then, colonoscopy rates have actually been increasing, which is great. Colonoscopy rates have increased in the 45 to 49-year-old by 7%. Still need to increase them, but people are getting aware. I still speak to people about colon cancer, and there are many people that don't even know that. They still think it's 50, so they're not even aware of the 45-year-old. This is why it's important to see your physician, get your annual exam, talk to them regularly so you're aware of these things. So important. And we always think about the celebrities. I always use their stories, not because they're more important, because that's sometimes what it takes for somebody to stop in the tracks. When they're a celebrity that they see, the singer they always hear, or Chadwick Boseman, such a young, rising star, to hear about their cancer experience really sometimes is a thing that strikes us. And they were like, oh no, if they can get it, then we can too, which of course. So what are the causes, potential drivers of this early onset cancer that we're seeing? Let's start with our lifestyle and diet. And this is the unfortunate as we see younger. We can always say, right, we ate better, or Gen X was we did everything right? We were outside all the time. We never got sick, what have you. But the truth of the matter is the diet has always not been great, but the foods that we're consuming are really our detriment. Increase in processed foods, sugary beverages. And you may ask, what is a processed food? So anything that's actually altered is processed, to be honest. So not everything that's processed is a bad thing. When you go home, you get your vegetables, you make your dish, you've processed the food. But ultra-processed goes through additional steps. More products are added to it to preserve it. And now it is altered to where it's not the normal. It's not what it originally was. It has now changed. And this is where we are seeing effects on our body. We're seeing where it is causing heart disease, obesity, diabetes, and cancer. So this is what we're seeing in this younger generation. Before, we would have our home-cooked meals. Now, home-cooked meals are a thing of the past. So ultra-processed foods is where their calories are coming from. And that's a problem. That's really a problem. The WHO actually says that processed meat increases colorectal cancer by 18%. Yes. And processed meat, you may ask? So when I was little, processed meat was the pottage meat that would come in the little can that, to be honest, I don't even know what it was, but we ate it. Now, even processed meat, the deli meat that we consume that's high in sodium, we need to be careful. So processed meat can really get us, and we see that it's increasing the rates of colon cancer. So be aware of that. Another thing is the obesity epidemic that we have in metabolic health. We do seem to think that obesity is under everyone's control, and that's not the truth, which is why I like to say obesity and metabolic health, because there is a complexity of reasons why some people may be heavier than others. There are genetic links. There are reasons why they may crave food more, may not feel full, why their metabolism doesn't work the way ours are. There's so many things, including lifestyle, stress, family life, that can play into why we see a rise in obesity. And I think back to when I was in residency, pediatric pathology, which is we go to the hospital for children, and you would see a lot of pediatric tumors, appendixes, right? But you know what I saw a lot of? Gallbladders. And the interesting thing about the gallbladders is that usually, you when you get older, right, you've heard of like your grandmother, somebody, or your auntie having to have their gallbladder out for stones. Well, a particular gallstone is called a cholesterol gallstone. And they are full of lipids and fat, right? Also, what happens is the lining of the gallbladder has deposits of fat, which is called cholesterolosis. And I would see these in 14-year-olds. So we have been getting younger and younger with obesity. And that's something that we have to address because we think of it as just a visual problem, right? We understand the heart implications, the cardiovascular implications, but we don't understand the cancer implications of obesity. So that's something, too, that could be one of the reasons why we're seeing younger and younger people with early onset cancer. Also, when we get into environment, I want to talk about the microbiome. So your beautiful, lovely skin actually has tiny little microorganisms on it. But no fear, because this is your microbiome of your skin, as well as your inner side, your intestines, your stomach. They have a microbiome. And these are here actually to protect us. If you hear sometimes when people get sick or they take something, or ladies, when we may take things and we wonder why we now have an infection, it's because we have disturbed our microbiome or our pH, and now we have an infection that's overgrown when the other organisms were actually keeping us safe. So there is a belief that there's a disruption of our microbiome from things that we're consuming. There's also belief that the environment around us, which we know, especially when we live in big cities where there's factories or even small towns where there are certain buildings or plants put up, that their toxins and waste are in the water, they're in the air, and they are harming us. Microplastics, the pollutants, all of these things have been studied, and some are directly linked to cancer. Also, it's important when we're talking about the environmental risk factors is for you to look in around. I personally have been looking into a cancer cluster, and I have found it's amazing because you think, first of all, cancer doesn't happen to you, but you start seeing a pattern. First of all, you rule out, are there genetic causes, right? And when the genetics is ruled out, when no one has a genetic link, you start to think, is there something in the environment causing this? And I can tell you two things that you can do. You can go to your state Department of Health and Environment. It may have a different name depending on the state. So your state Department of Health and Environmental Services, and reach out to them by email and tell them you're seeing this cluster and, all the history you can, and that you're concerned, and they'll call you. I literally got a call right back so I could further go into detail. You can also reach out to your state cancer registry to find out as well. So those are two things, if you're concerned about a cancer cluster from environmental causes, that you can look into to find out. You also, if you don't think it's environment, but you think that you may have a genetic link, get your family tree together, get all the information you can, and make sure, including the age of presentation of cancer for your loved ones, and share that with your doctor. So you can talk about if you are eligible to get a genetic counselor and genetic testing. So important. So important. Because we have to know this, not even for us. If you have cancer and you're like, okay, I'm fine, I'm going to deal with it. What about your loved ones and other people in the environment? If you don't step up to the plate when you have cancer or don't, and try to research or find out why you had it, or at least get the testing done so that other people can move forward. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. There's also this young gentleman that I met in the Colorectal Cancer Alliance, and he had Lynch syndrome. He went off to college. He was probably going to be a budding athlete as a football player. And he started to notice he was getting really, really sick, lost a lot of weight, and ended up actually in the ER and had colon cancer at 20 years old. Now he's doing advocacy. He's not playing basketball anymore, but he had that life-changing event really made him put things into perspective. And he wants to raise awareness, of this, is that I have this genetic syndrome, and it's going to make me have to go to the doctor more, get more visits, but also he's going to let his offspring and his family know as well to see who else has this. So it's so important that we share this information, whether it's in our environment or in our bodies, in our health, and our families. Yes, so important. Because about 10% of early cancers are genetic. So while we're talking about why they're rising, the genetics parts hasn't risen, but what we are seeing also is it's a multitude of things. It's a compounding effect. So you can't just wipe out and say, oh, that person had cancer because of X. Because even if they had Lynch syndrome, which I think Lynch syndrome is one of the rare things that directly causes cancer. But for some other people that may have a familial cancer, their mother had cancer, they don't know exactly if it's genetic. There's no BRCA mutation or anything. But even that, if you know that your risk is higher of getting cancer, what are you going to do? You're going to start to prepare, right? Because you don't want to have any heavier load. You're going to try to offload it. So you're going to offload it by checking your lifestyle and diet and not doing the things that are harming it. You're going to also try to prevent obesity and check your metabolic health. If you need additional testing, get a specialist. Check your environmental exposures as well, your stress levels, all of those things. So you're offloading yourself to decrease your risk for cancer. And I think that's how we need to approach the youth and the younger people getting cancer, is we need to offload their risks. They've been compounded over time. We know more younger people are getting cancer. What are we going to do about it? And one of those things is screening. The problem is, as I've mentioned before, is that not everyone can get screened. When the age for colonoscopy for average risk is 45, what about the younger people? I had seen a biopsy of a 34-year-old, and I think storytelling is so important, by the way, everybody. She was in her 30s, just happened to be part of a study, and the study was at a cancer institute and involved just doing the Cologuard testing, you guys, which is a stool sample test. And when she did that, she found out that it was positive, and that reflexed her to go to the GI doctor. So the GI doctor did a scope, and everything looked normal except for one polyp. So he sent it to get it sampled to pathology. And I called him and I said, did you see anything? Is there any history? She had a family history of cancer, which increased her risk, but she's still young, but nothing else, right? So the person that had cancer did not make her, for most people, if you have a family member like a mother or father that has cancer at 45, then you would get screened at 35, 10 years before them. But she didn't have anything that necessitated earlier screening. But because she was part of that study, she got it done. He said she didn't have any changes, bowel changes. She didn't have any signs or symptoms at all, just as one polyp. And it wasn't that big, by the way. But she had a tubular adenoma, which increases your chances of cancer, and you actually get screened more, but it's not cancer. And then she had what is called high-grade dysplasia, which is a step up. It's a cancer that hasn't broken the fence yet. And then she had an invasive in the polyp. But if you think about those like lollipops, or I think about the suckers that you used to get from the bank. Back in the day, we would go to the bank with our parents just so we could get the dum-dum lollipops. But the tubular adenoma, or the polyp, is the lollipop. And then the stick is the stalk of the polyp. And when they take them off, if they're like that, there's a base. And so you know it's free. So hers was going down the stick, but not all the way down. So it was completely taken out. She was surgically cured, or it was surgically taken out just by that procedure. But imagine if she waited to her recommended age. If she waited until her recommended age, we don't know. Would she still be here? How bad would it have been? So I think now we need to start thinking about our screening guidelines and policies on a generational basis. We have a generation now that we're seeing increased cancer. How are we going to change those so that we can approach this right and make sure that we don't see more of this? Because we can't, the 45 can't work. Do we need to add Cologuard to it? Do we need to start doing more seminars, more awareness? I think that's so important. Also, biomarker testing, which is testing like PSA for men. The PSA, the prostate-specific antigen, which is a blood test, is a biomarker test because they're screening you to see if you have a specific marker elevated. Now, these are screening tests. So because it's high does not mean you have cancer. You can have prostatitis or inflammation of the prostate and have it high. The problem is that there's so many cancers that there's not a specific biomarker for all of them. And even some of them are elevated, but they're not screening tools. They're usually used when people have symptoms or for follow-up after you have cancer. So there's a whole question, how can we use that to help, especially with the younger generation now having cancer? And preventative policies, too. I think that's so important. We need to start thinking about how can we prevent this? What policies do we need to add for this generation? What was working before is now not going to work at all. When I bring us to a close, I want to talk about the emotional impact of this. Because every day that I hear about someone get cancer, from a diagnosis I make to a loved one, a family, a friend, it hits so hard because I'm like, I wish I woulda, coulda, shoulda conversation. And now that we know the facts, we know that we're having more cancer, no more woulda, shoulda, what are we going to do? We don't want people to have this turmoil, this feeling of panic either, but we have to be aware. And I think with the young people, that starts with them not thinking they're immune to everything. They're not Superman. And we've heard about what happened to Superman, but they're not the Superman. They're not immune. And they have to know that when they have signs or symptoms, they need to go to the doctor. If you're a friend or a family member, you've got to push them. They're healthy. Say, yeah, I know you're healthy, but can you do this? And listen, if you have to share a story like the story of the 34-year-old, please do, because anything we can do to get these youth to understand is vital and it's necessary. I don't call it fear-mongering. I call it fact-based storytelling. You're telling a story to prove a point, to empower change. If you are running down a road and it splits, and word on the street is that if you go to the right, there's a dead end, there's a crocodile, and there is a spikes in the road. You know from all of the history what's going on the right side. Are you going to make a left or are you going to make a right? So that's how I believe this information. You're informing someone to make an informed decision. That's all. It's not fear-mongering at all. We have to advocate, we have to push for better awareness among patients and providers on this. So both of us have work to do together on this conversation. So closing this, I hope you take away an ability to be empowered. Not fear, but I hope you take away, listen, the 30, 40-year-olds, we're seeing more breast cancer, more gastric cancer, more stomach cancer. More breast cancer, more gastric cancer, more colon cancer. What are we going to do about it? Hey, I noticed you've had symptoms. You need to check them out. These are the screening tests, but you are not actually in the group that may get these screening tests, so this is what you have to do. Those are the conversations that we need to be having, and I hope we continue them. Prevention, lifestyle, all of it's important. If you have a friend, we need to start being those good friends. And those good friends are not the ones that lie, but tell us the truth. Maybe we can try changing our diet together. Maybe we can try working out together. Let's do those lifestyle changes. Or even where we are living with lung cancer. Those who live in certain environments, we're seeing more people that are not smokers get lung cancer. So what is pollution? What is the environment having to do with that? A lot. So think about where you're going, where you're moving to, all of those things. I hope that this empowered you all. There's also an episode I would love for you to listen to from prior episodes, and that is Know Your Breast Density. And that's for everyone. Everyone needs to know about their breast density and what that means. So great episode, everybody. Thank you. Enjoy. Have a great day. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.